I'm Alison Cox, and I'm currently the Policy and Research Director at the Global Climate and Health Alliance. And helping and co-host is Jess Beagley, who's also going to be helping guide us through this webinar. Today, we're going to look at the national planning process on engagement in your country's nationally determined contributions process, the NDCs, and that's whether or not it's already been submitted by your country.
Thank you so much, Alison, and again, thank you everyone for joining. We really do regret that it's not possible to find a time for everyone, and we really hope the recordings help. We'd love, if you're listening to the recorded version of this webinar, if you could still engage in the Twitter action later and also provide some feedback in the feedback form. That would be wonderful. We will keep tracking it. So these webinars are intended to be an opportunity for interactive discussion and information sharing. There are some things that we as GCHA know about in detail, and there are other things that we have a light overview of, and there are plenty of other things that we know very little about. So the idea is that we will share information on the things we do know about, but we also really encourage everyone to also share what's happening in their country or in their networks and relating to climate and health policy, so that between us on these calls we can build up the most complete picture possible. So at the start of this call and others in the series, GCHA and often also WHO will present a few items at the start. And then if there's more detail you'd like to add on the same issues or any other policy updates that you'd like to share, then we'd really love to hear them. After those policy updates, we will hear from Nova Tepe from the University of Wisconsin, who will present on engagement in the US NDC process. This was done prior to the NDC being announced in April at the Leaders Climate Summit hosted by President Biden. And this will then be followed by a presentation by Yasna Palmeiro, President of the Chilean Society of Planetary Health and also at University College London. And she's going to share some of the work that's being done in Chile, both before and after the NDC was submitted. Both Yasna and Nova will be sharing their tips for how to engage effectively in NDC processes as part of those presentations. We'll then have some time for the Q&A, and we'd really encourage you to share experience of anything that's worked well in your own national advocacy or barriers and challenges that you've experienced. We'll then have some time for some coordinated Twitter activity, drawing on the IPCC report and GCHA's Healthy NDC scorecard. And we'd love it if you wanted to participate in this, regardless of whether you're listening to the live version or the recording. Next slide.
Jess. The first section then is going to be the global policy updates. And this is where we at GCHA will cover in more detail some specific areas of policy. In this week's session, we're going to cover the IPCC report, the status of the submitted NDCs, and then we're going to briefly touch on a series of policy briefs available from the Health and Climate Network. First up, I'm going to talk about the IPCC report. You'll probably have seen coverage about the report in the media this week, and you may indeed have looked at it yourself. So first of all, a little bit of background about what this is. The Intergovernmental Panel on Climate Change was established and endorsed by the UN General Assembly back in 1988. And so their reports are actually requested by government. They have commissioned them. And the initial task requested by the UN was a comprehensive review of the science of climate change, what the projections were, its social and economic impacts, and the potential response strategies. And the report this week is part of the 6th assessment cycle, and it's the first of 3 working group reports. So this report is focused on the state of climate change, of the current predictions on temperature increases and their impacts. And the Working Group 2 and Working Group 3 reports are going to be published in 2022, next year, and will include further assessments on the impacts in more detail, including health, and a report on the possible response strategies. And what does this, abbreviated terms, AR6, Assessment Report 6, what does it say? Well, first of all, it says that the changes we're currently seeing at just 1.1 degrees Celsius, and that's a global average. Whenever we talk about these temperatures, we're talking about global averages with different rates, particularly at the poles, where they're warming faster. And it says that this is unequivocally a result of human activity that we're seeing these unprecedented rates of increase in temperature. It analyses the global temperatures under 5 scenarios in the report, from best to worst case scenarios, and with ranges of confidence across each of these analyses. And across each of these scenarios, which spread from 1.4 degrees Celsius under the best case scenario, and 4.4, catastrophic, absolutely unimaginable, catastrophic, hotter than pre-industrial levels by the end of the century under the worst case scenario. So whatever happens, we will see a rise in temperature, even under the best case scenario. And that means that not only do we need to think about mitigation strategies to try and minimize this, but we also inevitably have to think about adaptation strategies and resilience programs, because we're expecting some degree of temperature rise. Even at the lower end of the ambition, the 1.5 degree ambition under the Paris Agreement, we can expect to see extensive damage and impact. And the report talks about these in terms of climate driving impacts like heavy rainfall and heat waves, which will be more frequent and more intense, and that sea level rising and coastal erosion will continue. And that these will have impacts on the planet, including impacts on sectors of the economy, on society, and critically on health. So this report talks about these different scenarios and talks about potentially, how this will have impacts on Earth and according to specific regions. So the last 3 chapters of the report break it down into thinking about impacts for specific regions. Critically, a message from this report, although it talks about this certainty of temperature rising, there is a very strong message of hope, but a very strong call to action. It says, and I quote, "It's virtually certain that global surface temperature rise and associated changes can be limited through rapid and substantial reductions in global greenhouse gas emissions." So it's a very strong call to action saying we can definitely do something, but only if we do it rapidly and substantially now. So it's saying the Paris ambition, the lower level of the Paris ambition of restricting temperature rise to 1.5 degrees Celsius is not out of reach, but progress has to be at the pace which has been seen in just a very few sectors in a few countries so far. That has to be seen everywhere for 1.5 degrees to be achievable. It's not too late, but we need to act now. So the UN Secretary General, Guterres, his response used this very striking phrase that this is code red for humanity. And basically the call to action now is that governments have requested this science, they've asked for this report, and now they really need to act on it. And so we really need to get behind that call and make that message clear that this is code red for humanity and action is needed now. I just want to say one other thing, which is the most specific reference to something that comes up a lot in terms of the health and climate discussions is air pollution. And chapter 6 of the report specifically looks at findings on potential co-benefits for air quality and so health from achieving reductions in greenhouse gas emissions to achieve the 1.5 degree scenario. And it concludes that integrated policies are needed to yield multiple benefits from mitigating climate change, improving air quality, protecting human health, and achieving the several of the Sustainable Development Goals. So basically it's saying achieving the greenhouse gas emissions is not enough on its own, but will help achieve WHO guidance on air quality levels. But we really need an integrated approach to really achieve the reductions in the particulate matter and ozone concentrations that we need for the level of health impacts that we need in the WHO guidance. I just wanted to flag that because that's the most specific that this report gets to in terms of talking about this issue about air quality. So I know that's quite a lot of detail, and so I'll pause there, but I think the main thing to say is this report, this code red for humanity, and this is a real opportunity to say this panel has brought in this evidence now, governments really need to listen and act.
Thanks so much, Alison. I'll skim fairly quickly through this because it will be really great to hear from everyone else. But the 2 links that are visible at the bottom of this slide, these will be live when the slides are posted on the GCHA website afterwards. But I'd really commend WRI's Climate Watch resources to everyone. They're incredibly useful if you haven't already come across them. And to cover briefly where we're up to in terms of NDCs, which is really what defines whether or not we will be able to limit warming to 1.5, are these nationally determined contributions. And these are countries' commitments to reducing greenhouse gas emissions in line with the Paris Agreement. They're updated every 5 years, with the second editions for each country initially having been due to be submitted in 2020. Each update is supposed to be more ambitious than the last. So the UNFCCC released its first synthesis report based on NDCs that have been submitted by the 31st of December 2020. There are only 48 NDCs at that point, representing about a third of global greenhouse gas emissions. So even now we're already well over what was an extended deadline. The UNFCCC set another deadline for the 30th of July, so there was an influx in NDCs in the days leading up to that. But even now, there are many countries left to submit. There are 122 countries that are covered by the NDCs submitted so far. The EU submits one joint NDC, but it's 27 countries. But together, those 112 countries are responsible for about half of global emissions. And of the NDCs submitted so far, only 67 countries included commitments to higher levels of ambition when it's supposed to be more ambitious each time. An additional 52 countries representing about 31% of emissions have stated their intention to submit an updated or enhanced NDC, and there's just a couple of countries that I'll run through that are worth highlighting. They're relevant partly because they're major economies, but partly because some concerted effort by the health and climate community could make a really significant difference. Some of them are right on the cusp of submitting something. So for China, timing is unclear for the release of its latest NDC. President Xi has committed to a 65% reduction in CO2 from 2005 to 2030, and sectoral 5-year plans will be really key. And on that sectoral note, Alison is going to cover in a minute a useful resource from the Health and Climate Network. India has not even committed to release an NDC this year, so the timing of anything there is especially unclear. First NDC was, however, comparatively ambitious. It was in line with 2 degrees C. Brazil has submitted a new NDC, but it's actually less ambitious than the previous one, which was already insufficient. Brazil is in line now with a 4-degree rise rather than a 3-degree rise. And it also got a health score of 0 in the GCHA Healthy NDC scorecard. And for South Africa, the NDC has been drafted and was released for consultation. GCHA partners, the Public Health Association of South Africa, the South African Medical Association, and AMREF Health Africa submitted a comment. The draft NDC was an improvement on the NDC, moving from being in line with 4 degrees C to 3 degrees C. And then for South Korea and Australia, both of these countries had already submitted NDCs for this round, and they may submit an update before COP, even in addition to that latest NDC. South Korea's new submission was an improvement, and the previous one was aligned with 4 degrees C. This one is a little better, but we're not sure how much better. The numbers are still being crunched, but more is still needed. Australia repeated old targets with no increase in ambition, despite writing in its NDC that it was on track to overachieve its previous targets. And Australia also got a health score of 0 in the GCHA scorecard. And so those are just a few countries of particular interest. But of course, we need progress everywhere to deliver the levels of achievement that are needed.
Thanks, Jess. The third thing we wanted to flag up to you today is some incredibly useful advocacy resources. As Jess said, we originally considered whether to include a sectoral focus as part of this series in this list of topics, but we thought there is in fact already some excellent resources, including the suite of policy briefs by the Health and Climate Network. And the Health and Climate Network is an initiative started by the Wellcome Trust, formed earlier this year, and it's bringing together organisations working across multiple sectors, health, energy, transport, food, to develop joint recommendations. And their steering group members include WHO, GCHA, and a number of our close partners. And the Health and Climate Network recommendations are presented in 4 short policy briefs, short but incredibly well formed and well informed. The food brief, which talks about the link between food policy, food systems and climate. That brief was has already been launched during a high-level political forum. And the energy brief was launched just over a week ago, and still to come later this month is one on transport and one on healthcare systems, which will span both mitigation and adaptation. So they're coming along shortly. The link is there, and I really commend these to you as really useful resources in helping to understand, have references and lines on these cross-sectoral issues on climate change and health. Okay, thanks. I'm going to pass over now to our colleagues at WHO for their updates.
Thank you, Alison. I will be brief. I will update on something that I know it's already familiar to you. I don't have slides. Maybe I copy-paste in the chat a link to the public page where you can have a look at our report. I think you are all familiar. I hope you, if not, WHO is preparing in collaboration with public health community a special report for COP26. So the report we are going to title The Health Argument for Climate Action. And it's intended to really raise the voice of the health community and to bring the health argument and the sense of urgency for the health community in the important step that we need to take to tackle the climate crisis. So it's going to be the report like a collection of evidence, and a lot will be derived from the IPCC report that has been released, as Alison was presenting at the beginning of this webinar, but also will bring some solutions and key recommendations from the health community on how really to maximize the health benefit to tackle climate change. So basically, where we are with this process of developing the report, we are in an ongoing open public consultation. So if you click on the link that I put in the chat, you will find basically the draft report and a feedback form that we invite you to revise. And if you like to provide comments, until 25th of August, we'll collect feedback. This report was already in a previous form, already shared in an online webinar with people that decided to join it. And we are trying to really reach out as many as possible health colleagues around the world. But we also actually collecting on top of, ideas and views for the report. We also have an open call for case studies on climate change and health. So we love to collect short or real life innovative projects and solutions coming from the health community to address climate resilience health system, reduction of emission in healthcare facility, promotion of climate future, or also experiencing the transition from COVID and basically investing on greening and bringing health into the post-COVID recovery. So everything that it could be a useful example on how the health community is already acting and looking for solution, promoting solution to climate. And then the call for case studies, I see some familiar face that from people that I have already submitted example from your ongoing activities. Thank you very much. If you haven't done it yet and you are not aware of this call, I just copy paste the link again in the chat where you can find the call for submission of case studies. And some of these case studies would be also selected to reinforce the message into the COP26 report. And if not directly in the COP26 report, we will ask you, if you submit something, we'll ask you the authorization to publish all these examples also on the WHO dedicated webpage for solution on climate and health from the health community. I think these are the two main updates I would like to provide, and maybe in future webinars, something more about the COP26 health program, but when we have some news to report.
Thank you so much, Marina, and especially for such an extensive consultation process. It must take a huge amount of time and effort, so we're all really grateful. Nova has been an incredible support to GCHA. She's coordinated a team at the University of Wisconsin to be developing policy briefs to support engagement in national NDC processes. And she's going to cover what's been happening in the US. Thank you so much, Nova, and over to you.
Thank you so much, Jess. So yes, hi, my name is Nova Tebi. I'm an MPH-MPA graduate student here at the University of Wisconsin-Madison, and I work with Dr. Jonathan Patz. So I'm here today to talk about the US policy brief that we wrote for climate and health just before the US updated their NDC. The goals of this policy brief, one was we wanted to outline climate policies that are healthy, equitable, and can contribute to a just COVID-19 recovery. So again, this was, the US updated their NDC in April. So this was right around the time that vaccines were starting to get ramped up. So we wanted to prepare and show that, you have policies in climate change for climate change mitigation. It'll also help with COVID-19 recovery. The second goal was we wanted to show that an ambitious, nationally determined commitment with health and equity included is realistic. And we wanted to show that through the policies that we recommended in this brief. And then finally, we wanted to influence the US to update their NDC to include health, and we wanted it to have ambitious greenhouse gas emission reductions. So those are some of our goals for the policy brief. The brief contents is pretty simple. So it has a preamble that basically describes the need for an updated NDC with health and equity, and then how a COVID-19 recovery can have this co-benefit with climate change mitigation. And then we also have an introduction and overview, and this outlines why the 2016 US NDC is just not enough, what needs to be included, and how it ties again into this COVID-19 recovery, build back better, as Biden would say. And finally, we have our policies. And so we have organized these policies into 3 sectors: energy, transportation, and food and agriculture. Obviously, there are other sectors that we could focus on, but we wanted it to be simple, and we also wanted to look at sectors that contribute the most to greenhouse gas emissions. So that's why we chose those 3. And to kind of give you a snapshot of policies, this table is part of a larger table that gives a summary of all of the policies in energy, transportation, food, and ag. This is just our energy policies that we recommended. So we have what the policy is, and then we outline the health impact, the equity impact, and the political landscape. I'll discuss more of the health impact and equity impact in the next slide, but I did want to point out that all of them are positive. So obviously we didn't want to recommend any neutral or negative impacts for health and equity in any of the policies. So all of them are positive. And then with the political landscape, this rating is more about, is there a bill in the legislature that's very similar to this policy? Are there states or cities that are implementing this policy now? Are there organizations, that have been pushing for this policy, that sort of thing? And so that's how we give the rating. It's more like, what's the presence of this policy in the US? And that's how we ranked our political landscape. So again, to go into our health impact and our equity impact, what we looked for. So for the health impact, we wanted to focus on social determinants of health. So examples are income, housing, built environment. Another one would be education. But we also looked for improvements in physical and mental health. So were there reductions in the incidence of lung-related illnesses, et cetera, with these policies? And we also looked at reductions in greenhouse gas emissions. Does this policy help to reduce these? Because that has a lot of health impacts just within itself. For the equity impact, we were looking for, does this policy give community ownership? Does it mandate community input? Is there equitable implementation of that policy? And does it focus on frontline communities? These communities who are directly affected by climate change, but have kind of been disproportionately left out of the conversation of the policies for climate change mitigation. So that's how we ranked the health impact and equity impact as well. And then once we finished the brief, we had 2 main targets for delivery of the policy brief. One was Gina McCarthy, and she's the White House National Climate Advisor in the Biden administration. Luckily, Dr. Jonathan Patz had already made contact with Gina McCarthy, and so we were able to communicate and say, we're writing this brief, we'd love to share it with you. So we were able to share it with Gina McCarthy's team, her office, which was awesome. And we also asked if they could forward that brief then to John Kerry. And John Kerry's the special presidential envoy for climate in the Biden administration. And they were also able to do that. With Gina McCarthy, her main focus is domestic policy. So we were able to get this policy brief in kind of the domestic sphere. And then John Kerry has more of an international focus. We were able to get the brief on that stage as well. So we were really happy with the target for this policy brief. And now, changes to the US NDC, kind of what we looked for. So the 2016 NDC for the US was a reduction of greenhouse gas emissions by 26 to 28% below its 2005 level in 2025. When the NDC was updated, which was about a couple weeks after we submitted the policy brief, the new NDC was a reduction of 50 to 52% below 2005 levels in 2030. So definitely a larger target. And also in the NDC, there was recognition of health eco benefits in mitigation in electricity, generation and in transportation as well. So we'd like to think that our policy brief definitely made the argument of health and climate and equity very persuasive, that they wanted to include that in the overall updated NDC. And with that, I'd like to say thanks, and I'd like to thank everybody who helped with this US policy brief. So Dr. Jonathan Patz, Madison Zhang, Jess, and Jenny, who are awesome and helped us a lot, and overall the Global Climate and Health Alliance. So thank you so much.
Well, thanks to Nova and the team. And there's been an additional policy brief that's been put together, both with the University of Wisconsin and with partners in South Africa, that were mentioned earlier. I see James is on this call, so thank you, James, for all of your work and to support the engagement in South Africa as well. I'm going to pass over now to Jasna, who's going to talk about engagement in Chile, both before and after the submission of the NDC.
Thank you very much for the invitation and for the opportunity to present this to you. My name is Jasna Palmeiro, and I'm going to talk about a little bit more kind of the perspective of this process from Chile. So I'm going to cover these 4 ideas: what you need to engage, how to engage, some experience in Chile, and some final takeaways. So the first thing is why you need to engage with this. And probably you have many motivations, some internal motivations, but also some external motivations. Probably you want to learn how policymaking works, or how to influence others in policymaking, or you want to put some research into practice. You're a researcher in a university, and that you want to put all your findings into in real practice. Or also you can change the world, and you want to change the world, or you think that it's a moral duty, or just because you're curious. And all of these are absolutely valid internal motivations. But also you have an external motivation because it's your work and you've been paid, so you have to work on this. Now, this is the why, and probably they are quite easy to just identify them. But the problem comes when we think about the how we engage with policymaking, how we engage with policymakers as well. Well, we need to think that this is a very difficult process, actually, and there is no one best way. There is no standard way on how to engage. My idea in general, in terms of how to find the best strategy is, well, to understand how policymaking works, basically, because sometimes we have, and I am quite biased because I'm from the academia, so probably we need to understand how this world works in order to optimize all the process of engaging. And then just some ideas about how to understand this policymaking process. We need to know that policymaking is not evidence-based, okay? At best, it's evidence-informed, actually. So our work is just to inform policymaking processes and inform policymaking just to make better decisions. But also policymakers are not focused on evidence quality as we are, actually. We're really, really focused on the quality of the evidence, and we do not make strong statements when the quality is not so good. But the issue is that policymakers look for relevant evidence to solve some policy problems. So relevance here is key for them. Also, as probably we all know, that there is too much information and sometimes it's quite overwhelming. So probably policymakers should make some cognitive shortcuts to make better decisions because they cannot manage many things or many areas at the same time. And finally, the policymaking process is quite complex, and we need to be aware of this. It's not easy. There are many actors, there are many circumstances that we need to be aware of this. And also the climate change and health relationship has a lot of challenges, actually. Human health is affected by several factors, and climate change is just one of them. So probably we need to take into account that there are other problems related to poverty, related to inequity. And if we can identify all of these problems that are relevant to policymakers, probably we can make a very good strategy to cover all of them. And finally, climate policy needs to be based on scientific data, and we know that, and scientific data is quite robust nowadays. But the issue is that most policymakers are not climate scientists, so the understanding of this evidence sometimes could be a little bit difficult. Now, from my experience and knowing all of this kind of a theory information or the information from the evidence, actually, I've been working with the Ministry of Health in Chile since, well, actually before I came to London, because actually I'm here in London. And we had a very good meeting. We understood each other. I understood all the problems that they have, because actually we had a very sincere conversation. And the issue was that we kind of make and understand each other and make a kind of a collaboration statement or something like that in relation to this work that we can do together. And after this, I participated in this policy brief for Chile, which was the first one. And of course, we made it was made by the Lancet Countdown in collaboration with the Public Policy Center at the Universidad Católica in Chile. And we launched this policy brief, not just considering academia, but also we considered and we invited people to a discussion table from the health sector, from the academia, of course, from local government. So we shared many opinions and many different points of view. And of course, all of this was a very good discussion because it was enriched by different opinions. And also we were available to appear in the media and in some channels, and you need to be available for them. And you need to transmit information quite easily in order to be understood by them, by non-specialist audience. And also we worked through social media, making different contacts as well. Now, we continue working with the Ministry of Health, with the Ministry of Environment, actually. And in this photo here, you can see that we provided a kind of a session training to different people in the Ministry of Health, because they do not many things. They work on many things, but they do not many things in relation to climate change and health, actually. So basically, this session helped me to understand their point of view, their questions. So then I was able to understand the position in which they are, and then just to incorporate all of the questions into my work. So probably I can make something more useful for them. And also we've been working with the Ministry of the Environment on the long-term climate strategy. And here, so we just worked and discussed many things about how to incorporate health actually in this strategy. So finally, my conclusion from this experience was, please keep a continuous contact or be in continuous contact with main stakeholders. And you need to identify your stakeholders and also work with them and work continuously. And these stakeholders could be, well, very different stakeholders, not just the government, not just the central government, but also some local governments. They are quite interested in this topic. Incorporate these different NGOs, because probably with some collaboration, you can improve the impact of your work. Include community, include the media. They are quite a very good stakeholders and very good partners. And of course, the academia. And probably the most important thing here is that you need to build very good and a strong partnership with different stakeholders. If you work alone, the impact of that is going to be quite slow. But if you work with other people, work with other stakeholders, then probably this impact will increase. So think about a win-win relationship and also be available for them for every partnership and be patient as well. This is not easy, but it's a process. And finally, these are my 4 takeaways considering the evidence and also my experience. So have in mind the key message that you want to transmit actually, and this message should be policy relevant, should be evidence informed based on data. But please just identify and highlight your key message. Also cultivate good partnership and ask yourself, who has the power to make some changes? But please cultivate this partnership. Then make your research or message readable and clear. Please do not make a very complicated plot because it's quite nice. No, just a very simple plot, a very simple statement in plain language, plain Spanish or plain English. But please transmit the message very clearly. And finally, all the climate policies it would be good if they are embedded within broader strategies. Sometimes one climate policies could be not useful for one policymaker because, I don't know, it is quite isolated within other policies. But if you combine some wins-wins in terms of policy, then probably your impact will be greater.
Thank you ever so much, Jasna, and especially for breaking things down so clearly. I really appreciate it. I'd like to know one challenge or barrier that came up in your process of trying to engage in the process, and whether and how you managed to overcome it.
So for us, creating this policy brief, it was finding the policies that were, evidence informed, as you just said, and making sure and analyzing them on this health and equity impact. And we wanted to really make sure and do our research that, we didn't want to recommend any policies that were just inequitable and we missed something. And so we really double checked, and I think that takes time. And sometimes you don't have time when you're creating these policy briefs that are, on a certain deadline. And so that's definitely one of the harder parts, but we were able to get through it, and we're really happy with the end result.
Yeah, that's very interesting. Yeah, actually, I think that I've got many challenges, more than one, actually, probably 10 or more. But I guess that one big challenge, and it was at the beginning of the process, it was like, okay, we need to understand the language of policymakers, so what would be of interest to them, actually, what would be useful for them, and how we can make some recommendations. But now, if you ask me, if I see and I read the policy brief and other intervention that I've made in the past, probably I would change some things, because now I see all of this and I say to myself, actually, this could be better, So sometimes every time that you read your policy brief, or you just review some videos or some interventions, then you need to learn what would improve from this experience. So yeah, so many challenges, how to combine two kind of different worlds, more one world most related to the academia, to the scientific part, and another world which is more kind of course, policymaking, which has a very different goal. So I think that you need to think about this just at the beginning of your process, and ask questions and discuss these questions with your partnerships.
Thank you both. And yeah, they're definitely things that I've experienced and felt, and that tension of knowing that if you never make a policy recommendation, then there's no way it will be acted on, and the longer you leave it to perfect it, that's a real struggle, but it's really crucial to maintain credibility and make sure that what gets put out is the right thing. Does anyone else have questions for Jasna or Nova?
There is a question on the chat from Claire.
So when making policy recommendations, would you advise to go into more detail or less? We want to make recommendations, and these can be quite detailed, but some quarters feel it should be short for policymakers. The concern is that we don't want to lose out on working in all of the points of concern.
Well, actually, it's a very good question and a very difficult one. I think that you need to maintain a balance between not giving too much detailed information, because you need to consider that policy making process is usually made, considering many other policies that are run by the government or other bodies. So sometimes you need to balance the amount of information that is detailed. You need to transmit quite some facts quite clearly, but also giving some space to some changes and some adaptations in the future, I guess.
And I would just say I agree with everything, but I would also add too that it depends on where you're putting the detail. So in terms of like writing what the policy does, like whether it's a legislation, whether it's something with the regulatory system, that might not need nearly as much detail as when you're trying to be persuasive and present evidence of why we need this policy. That would probably require a bit more detail, and also just making sure you have really good data or evidence that's really persuasive all on its own, even if it's one sentence. So I think it depends, and it's also a balance.
I wonder if there's also a question there about whether or not the contribution, is one that's been asked for, or one that the person providing it has decided to put together. And I actually think there's also an opportunity there, to build a relationship and to ask a policymaker how much information would be useful for them and what they would find most helpful. I think if it's a general contribution, then if it can be less than 4 pages, then that's always a win. And generally the shorter the better, but it is such a huge challenge. But then some policymakers really do look for more, but generally better to assume shorter. Thank you so much, Nova and Jasna. I'm so grateful to you for sharing your time and your expertise.